Hi, how's it going? My name is Mikayla Beddes. I am a public health major with an emphasis in health science. I'm studying public health. I originally got into the major thinking that I wanted to be a PA or go and do PA school after graduation, but I quickly realized the societal impact that one can have when working in public health and kind of the potential that it has to reach the masses as opposed to kind of ministering to the one, which both are so important, but that kind of like drew me a little bit. I am expected to graduate from BYU spring of 2025. I get my crap together. For this class, I'm hoping to get a better understanding of policies, policy making, and honestly get the requirement out of the way and continue on my path. In terms of positive or negative interactions that I personally have had with the health system, the first thing that comes to mind is I served as a full-time missionary in Santiago, Chile, and I had a companion at one time who was like deathly allergic to peanuts, and it came to pass that we were at a member meal and there were peanuts in the food, or she just came in contact with it in a way that induced anaphylactic shock, which was terrifying. And so we like gave her her EpiPen and we took the metro to the closest hospital, to the closest ER, where we ended up waiting for about 5 hours until she had been seen. We ended up having to go to a completely different hospital. And I don't know if it was because like just the way that that particular ER was set up, because apparently like all the members told us like you went to the wrong place after, but it was the closest one. And it felt like, well, it was like a really dire situation. And so yeah, we ended up waiting for over 5 hours for her to be helped for something that was so immediately pressing and necessary to be treated. And so yeah, that was something that had happened before I entered the major of public health, that kind of also pushed me to consider like the power of policies and the power of like organization in our healthcare systems that influence so many people. That companion totally could have died. Let's see. I consider myself to be from Lehigh, Utah, which is super exotic, super crazy. It has impacted me because it's a pretty like conservative little corner of the world, and there's not a lot of diversity, and everyone is pretty much just white and members of the church. And so I lived in Texas for a time as well, and I've kind of been all over. So not all over, I would like to go all over more. But it has helped me to see like the lack of diversity that there's in Utah and how like damaging that can be when raising children and raising a new generation, because they tend to be more like closed-minded, less aware of like the social and the political issues that are going on in the world that just don't affect them. One person who's influenced my political values and opinions, I have a couple friends who are very strong, like deeply rooted in their political beliefs, and they were the opposite of what kind of I'd been raised in. And those friends, alongside with like social media and seeing different political and social issues arise, are kind of what has shaped my political values and opinions. An important relationship that I have with someone who is very different from me. I am actually engaged to a man who's from the Dominican Republic. He's lived in the States for about 5 years. And so his whole like life experience is vastly different from mine. His opinions on things, the way that he just like sees the world is so different, and also the way that he is treated and the way that people perceive him here is really different from me. And that has been something that's been so important for me to explore and to know more about. And among other ways, like, it's a way that he has blessed me in my life. Anything else that you should know about me? I don't think so. I work at a greenhouse. I really like plants, and I am very passionate about public health, so thank you.